As the coronavirus continues to spread, healthcare providers say there may only be one way to stop it until we have a vaccine. Medical reporter Liz Bonus takes a look at what it means to go to extremes.
It's true, we might all be better protected against COVID-19 if we could live or at least do group activities in a bubble, right? Especially since the White House Coronavirus Task Force coordinator is warning Americans of a new phase in the pandemic. The virus is now more widespread and moving into rural areas.
And that's why we keep saying no matter where you live in America, you need to wear a mask and socially distance, do the personal hygiene pieces, but more importantly, if you're in multi-generational households and there's an outbreak in your rural area or in your city, you need to really consider wearing a mask at home, assuming that you're positive if you have individuals in your households with comorbidities.
In addition to that, the nation's top infectious disease specialist recently said,
if you have an eye shield and you'd like to wear it, it could help because virus could enter to the eye. That's not a recommendation that everybody should be wearing an eye shield.
So the question then is, who should go to these extremes? Wearing perhaps protective eyewear, putting on an extra face shield. And when should you do that? Well, if you talk to most infection control providers, they'll tell you you should do that when you or someone you love is at extreme risk.
If somebody coughs in your face who has the disease. So I think it's really a matter of risk stratification. If you're a healthcare worker where you're going to be seeing patients up close where you can't social distance, you're going to be taking their blood pressure, you're going to be, doing a physical exam, you really need to protect your mucous membranes in that setting.
As for the bubbles, only, he says, if you can't stay 6 feet apart. I'm medical reporter Liz Bonus reporting.